I'll have a look. This week. Hello and welcome to Senior Spot. My name is Jenn Quinn and I'm your host today, and this is our guest, Dr. Gregory Wu of Emerson Dental right here in Westford, and I'm so thrilled to have him here to tell us about some different tips and some different things that would be helpful to know for our seniors in terms of their dental health. So welcome, Dr. Wu.
Thank you for having me. It's an honor and a pleasure to be here today.
Great, excellent. We have a lot of things that we can cover today that I think will be helpful for our seniors and certainly their family members as well. So I would love to know a little bit more about how Emerson Dental in your practice landed here in Westford.
Yeah, actually, the previous owner, Dr. Alvaro Maya, started the practice from scratch in 2001, and he also was in the Army Reserves.
Oh.
And so it was a very busy practice. It started from scratch. It was very busy for him, and he brought me on as an associate early on when I finished my residency. I came on board for about 1 day a week, and then 1 day turned into two turned into three. And then he went through some personal things, and then he one day turned to me and said, you know, this is a little too much for me. Would you like to take over? And so, you know, fast forward here 8 years later, here I am. We've since then moved the practice not very far across the hallway.
So tell us exactly where you are in Westford.
We're at 133 Littleton Road in the Emerson Health Center.
Okay.
We used to be in suite 203. We're now in 201.
Okay, so I think when I went there in the past, it was right at the top of the stairs on the second floor.
That's correct. It's right at the top of the stairs. You can't miss us because we have a big fish tank there, so which all the kids love.
Beautiful renovation.
Oh,
Beautiful.
thank you. Yes.
So that's a pretty interesting story. I love that.
Yeah.
So you've been in a dental practice in Westford then since what year?
I've been there in the practice there since 2006.
Okay, excellent. So geez, we're
now-
10 years,
10
10-year
years, yes,
anniversary.
exactly.
Okay. So just going back to, you said there's a fish tank, and of course everybody loves a fish tank, it doesn't matter the age, but so I'm assuming though that there's some appeal and some broad range of ages that you do have that come into your practice.
Absolutely. We are actually a little unique than most dental practices. We're a multi-specialty practice.
Okay. What does that mean?
What that means is there's actually different specialties. We have a pediatric dentist on staff, we have a periodontist, we have an endodontist, and then there's 2 general dentists. So we start seeing children at age 1, 2, obviously 99, 100,
Wow.
100. So,
One?
Yeah, at age 1. So the pediatric dentist, Dr. Swee, will make balloon animals for the kids.
Does he make balloon animals for everybody if
He
it's
makes
requested?
balloon animals for everybody if they want it.
Okay.
Yes,
All
absolutely.
right.
And I can make it for them too.
Really?
Yes.
Okay. What's your animal?
I make a little puppy dog, so that's about all I can do.
Okay.
He's surpassed me. He can make swords, bicycles,
Wow.
octopuses.
So you're in for a good time when you come to Emerson Dental.
Absolutely.
Excellent. Well, I know that just knowing different people that actually work at your practice, it is a very friendly, fun place to go to. And you know, not everybody really digs going to the dentist.
That's absolutely it. Nobody likes going to the dentist, so we try to make it as enjoyable as possible.
Excellent. Great. So we know who you serve, which is a broad range. We know you're in a new space, which I think is important for people to know here if they've been accustomed to, you know, where you were prior. It's really just down the hall. So, you know, obviously our focus here is talking about seniors and different ways to be able to support our senior population. So obviously, you know, I've asked you here to do that, and I would love to just start off with knowing, why is oral health important for seniors? Now, it's important for everyone.
Absolutely.
And we tell our kids, no matter what age they are, but you know, and obviously having good oral health throughout your life is going to make a big difference as you get older. But, you know, what is it that's so important for seniors regarding oral health?
Well, the mouth is the gateway for everything. And, you know, I always tell this story that, you know, when I was in my residency, I had an 80-something-year-old man come in, and he wanted to have a whole new smile, teeth, everything. And I looked at him and I asked him, I said, you know, don't you want to spend some, because it was a very big plan and it was a lot of financial investment. And I asked him the question, why do you want to spend all this money on this? You know, I can make you something, you know, inexpensive, you know, and get you by.
Okay.
And he said, you know, at my age, you know, sure, I can go on vacation, but it's a lot harder for me. He goes, one of the few things I can still enjoy is eating. And I sat there and I said to him, I said, I can't disagree with you, you're
That's
right.
a
And
good
I didn't
point.
argue with him after that. I said, whatever you want to do, I'm going to get you healthy and functioning.
Right.
But more importantly than that, the mouth is our gateway to our entire body. So whatever we put in that old saying, you are what you eat. So, you know, good oral health is going to keep the rest of your body healthy. I always say, good oral health is going to give you good overall health.
Okay. Oh, I like that. I mean, there's a lot of, the apple a day keeps the doctor away, but this is a kind of a saying that, that could stick with people. And you could certainly start with the youngsters learning that.
Absolutely.
But I love the fact that you asked him the question of, you know, why do you want to do this, and helping somebody think things through. And I think that at a certain age, you just take things for, you know, you take things and you say, you know what, I think this is what I need to do. But it's really nice that as a doctor, you're able to help people think through things and plans.
Well, I always tell this story too to some of those patients. My grandfather, when I was very little, used to always tell me, you should only spend your money on 3 things.
Okay.
And he said, vacation, food, and your health.
Okay.
And growing up, I didn't really understand that as much until, you know, as I got older, I kind of understood what he meant by that. He used to always say, those are 3 things nobody can ever take away from you.
Okay.
Nobody can ever take away the food you ate and enjoyed. Nobody can ever take the memories that you took on your vacation. And if you spend money on health, nobody can ever take that away from you, because that was it.
Right.
Material objects will come and go.
And your health actually plays into what you can eat, and it plays into being able to go on a vacation. So it kind of all goes together. He was a wise man.
Yeah, he was. He's still around. He's 90. He's 92 years old. So
Awesome.
he's well and doing so.
And does he take your advice about good oral health?
Absolutely.
All right, good. Well, because if those are his corner, if those are the 3 things that are important to him, then he understands that.
Absolutely.
Excellent. I love hearing stories too. It makes so much sense to actually hear these stories. So, you know, I guess, you know, it comes down to too, what are the risk factors for seniors in dentistry? I think a lot of people might fear going to the dentist at any age, but certainly as someone might have some different areas of their health, maybe diminishing, declining, what are the different things that you're aware of that are risk factors?
Absolutely. One of the unfortunate things is as we age, things don't work as well.
Really?
Yeah. Unfortunately.
Yeah. Oh, I know. I'm noticing that.
You know, what's the alternative?
Exactly.
The alternative option isn't any better.
Well, and that goes back to keeping your health. Yes.
Exactly. So one of the risk factors for, you know, any patient, but more so in the elderly population, is dry mouth. You know, the saliva doesn't work as well.
Why not?
Well, most of them are on medications. One of the biggest things with dry mouth is one of the things with most medications is dry mouth is a side effect.
Right. I've read that, but obviously being our age, it's not something that would typically be a side effect we would see.
Yes, and because of the dry mouth, you know, you become more prone to gum disease, cavities, and
Interesting.
so
your saliva actually,
it does diminish over time just from age, but
Okay.
if you're on medications, even more so.
I know Coumadin in particular, I think, right? And there's
Correct.
other different things.
Yeah, a lot of antihistamines, blood pressure medications, they all kind of have dry mouth as a side effect.
Okay, so that's a risk factor. What do you do to help with dry mouth? What is it that people can do?
So there's over-the-counter products like Biotine that can substitute to kind of help it alleviate the symptoms. But really, if you have dry mouth, the best thing to do is to see your dentist more frequently for cleanings.
Okay.
That way we can eliminate the risk factors for gum disease, cavities.
Okay.
And then they also have prescription fluoride that you can use to kind of counteract that.
Yes.
So you do have to be a little bit more diligent. What I always use the example is, think of a car that has about 150,000 miles. You probably need to pay more attention to the maintenance on that than you would on a brand new car.
Oh, that's a good analogy. Absolutely. I know that some of our clients with my company that, you know, I've absolutely seen the oral care like regimen.
Right.
And it's so pleasing to see when our clients leave the dentist and they have step-by-step ways
Right.
of being able to do it. And being able to maybe give cues and being able to do those types of things, because you're not going to think of those steps. You need someone to come up with a plan.
Absolutely. I mean, a lot of times the patients say, well, I used to go to the dentist twice a year and that's all I needed. Well, yes, but things have changed now. Now you
Okay.
need to come more frequently for us to kind of counteract whatever it is, your
Right.
medical history, medications you're on. We have to kind of manage this a little differently now.
Sure, and I would imagine that insurance would be more aware of the need for it as
Yes.
someone ages.
They're starting to become more aware of
Good.
this so that they're starting to cover some of these procedures. Not
Okay.
all of them have progressed as we would like, but
Right.
we're getting there.
But I think as the population, the aging population increases, and it's actually going to be preventative, it's going to be proactive. Hopefully those are the things that will catch on.
Right.
Because it is true. I brought my daughter to the dentist the other day, and it's, every 6 months. So,
Yeah,
there's a
absolutely.
big difference between someone who is 12 and a half and someone who is, 85 in terms of their needs. And I'm glad that there's awareness,
Right.
and hopefully that's changing.
Yep. So, periodontal disease obviously is a risk factor for the elderly population as well. I talked about cavities as well. So I brought some tools here to just kind of show, how some the elderly can help with their oral health.
Excellent. I love show and tell. This is
Yeah.
great.
So this is a Sonicare toothbrush. It's an electric toothbrush. You can see here, and it vibrates. Sometimes, because some of the elderly, their manual dexterity goes down, so this will help kind of get to the areas where they can't reach.
Oh, okay.
I brought a cup of water so you can see how the sonic action works. You can see how this really bubbles, and you can see the water spraying.
Yep.
So this will allow us to get effective plaque removal.
Okay.
So this is a great brush where if a patient can't reach every little area, the vibration of the brush can actually kind of help get to it. Another thing I brought is some of the soft picks here. So we can see here, and then we can see, you can kind of get into some of these areas. In fact, this is a model of a patient that has periodontal disease and doesn't have periodontal disease.
Okay.
So I'll flip this open so you can see. This is healthy bone, healthy gums, and you can see all these teeth are very nice and stable.
Okay.
And if I flip over here, this is a patient that has gum disease. You can see
Interesting.
the little dark areas, that's tartar. When you have gum disease, you start to lose bone.
Well, and it's under the gums, which you
Correct.
don't see.
Yes.
So you're not even aware that there's
Exactly.
something brewing
Similar
below
to
the
if you had
surface.
diabetes or if you had blood pressure, you don't feel any pain, you don't feel any different.
Okay.
Some patients that they have gum disease, they don't know any different. They don't feel it.
So what are some of the signs that someone, if they can't feel it, what are some of the signs that people might pick up on, or certainly, apart from going to the dentist and you identifying? Is there anything that somebody would be, cognizant of?
Well, let me ask you this. If you washed your hands and your hands just started to suddenly bleed, would you be concerned?
Yeah, I
Yeah,
think I'd be
you'd
very
go to the
concerned.
doctor. So if you're brushing your teeth or if you're eating and your gums suddenly bleed, that's a sign that you have gum disease.
Okay.
Because that's not normal.
Right. So there's physical signs of that versus, well, I guess it's physical as well if you feel any sort of discomfort, but you're really going to visually see something.
Absolutely. Some patients do feel pain, some patients don't. That's why it can be dangerous, because some patients don't feel any different. They'll say,
Okay.
oh, I don't feel anything.
Well, I mean, that's amazing to see it under the gum line like that. Wow.
This is another example too, Jen, of another flosser. You can see it's a little bit longer handle, so
Okay.
that the patient can reach into real far back
Let me
areas.
take a peek at that.
Yep.
So this is something, and all these things are, I'm assuming, over the counter
Yep, you
that
can go
you
to
can
any
purchase.
CVS drugstore and you can get to the CVS, Walgreens, any of those drugstores, they'll have those. They'll have a whole bunch of different options.
Because I do think that, if you're facing any...
And you can open that just so we can get a
Yeah,
better visual of
okay.
it.
We'll open it, see if I can. They package these things.
Yeah, they know it's...
I don't know. I don't know if I'm going to be able to do this.
My
But
kids can open it, but I probably can't.
and you go, oh, I got it. Okay.
There you go.
So it's interesting because you mentioned dexterity and then also arthritis, which it is true
Absolutely.
that sometimes you just can't get in there. And, it doesn't really matter what age you are. Sometimes, your fine
Absolutely.
motor skills are
So
just...
you can see here, most patients have the most difficult time getting the very far
Sure.
back teeth. So this has a long, nice handle. There's a rubber for the grip, and you can get in there to kind of floss in these areas.
And then you just replace it.
Yep, and then this one comes with a couple
Yeah,
cartridges.
I
You
see
can
that.
see there. Yep,
Okay.
it comes with a couple cartridges that you can replace.
Okay. Great.
And then another one. This is called a proxy brush. Again, some patients who have had periodontal disease, they'll actually have more spaces between their teeth.
Now, why is that?
Because of the bone loss, the gum will follow the bone, and so
Oh.
the gums will recede a little bit.
Okay.
That's where that term long of tooth comes from Shakespeare. Where
Look at
as
this.
the
We're
tooth
having an
gets-
English
yeah,
lesson,
we get
too.
an English lesson too. So the proxy brush gets right in there. You can see here, and the same thing. These little brushes will get these little brushes will get in between in the areas where the floss can't always get through.
You know, these tools remind me of when my son had braces. My daughter currently still has braces, but my son had braces. And all of these little tools were used to be able to make sure that they're still flossing when they had the braces. But what's interesting is that once the braces come off, very good about the retainers at night, but once the braces come off, we're not really using these tools anymore. And
we should.
I agree. I'm thinking, okay, regular floss is great, but you might actually be able to do a better job using these things. So perhaps we need to get to the pharmacy and pick up more of those. No, that's fascinating, and I love show and tell. So thank you for bringing those.
No problem.
So in terms of, you know, you showed us different things for flossing. If you were to say to someone in our senior population, what are the things that you should have, you know, in your, not medicine cabinet necessarily, but in your bathroom? What are the things that you feel are most essential for anybody to have?
I think if they're having trouble flossing, they should have some of these flossers or some of these proxy brushes to get in between the teeth.
Okay.
Because they're missing areas, because brushing alone will not get all those areas.
Okay, so a particular flosser that you prefer that works for you.
I like this Reach flosser that we had up there. That
Okay.
one is a nice one because it has a nice long handle.
All right.
Yep, that one right there.
Clearly toothbrush and toothpaste.
Yep, clearly toothbrush. I like an electric toothbrush, mainly for what I talked about. If you miss an area, the vibrations will at least get some of it.
Okay.
And they've shown that it can't replace flossing, but if you're going to do regular brushing versus having an electric toothbrush,
Well,
it can
you've
at
got
least
to
get
do it
some of
all. Like I have a system, you know, that I use that might be different. You know, I floss, I rinse, I brush. You know, that's my steps. I mean, what
Perfect.
would you say would be the steps that you would encourage people to do?
You know, some patients will always forget to floss, so I always tell them floss first and then brush. That way you'll never forget.
What
to
about the
floss.
rinse? Where does the rinse come in?
Yeah, you can rinse right at the very end.
Okay.
So,
Really?
yeah.
Okay.
Rinse at the end, because that's the thing that most patients like. They like to rinse because they like that feel afterwards. So
Okay.
I'm like, do that at the very end.
Okay. Oh, that's interesting. I do find it interesting, and you're talking about the gum disease.
Yes.
And I would like to have you talk a little bit about some recent studies that have shown the link between gum disease and more propensity towards having memory impairment, dementia. And of course, that's near and dear to my heart because
Yes.
in our company we work a lot with folks with dementia, and I think it would be great for people to understand the importance of taking care of your gums and your teeth, because obviously there are many health-related issues, like you said. You know, whatever you put in your mouth is going to affect you. But I'm really interested in hearing about this particular study.
Absolutely. If you actually go on the internet and you Google oral health linked to, and you'll see a whole bunch of things. It'll be
Okay.
you know, heart disease, dementia, all those things.
All right.
They recently had a study done with oral health and periodontal disease linking to dementia. They actually had slices of the brain tissue of a patient who had dementia, and they actually found the same bacteria that's in gum disease in the brain. So,
Really?
Yeah. So that's where they kind of said, look, there really is a link, because this bacteria that is known to cause gum disease is also in the brain of patients who had dementia.
So, oh wow, that's fascinating. I knew that I had just heard just roughly the connection, but I had no idea it had to do with.
So for that reason alone, you know, we really should make sure that if you have periodontal disease, that, you know, you really maintain it and take care of it so that you're not a risk factor for
Sure.
developing
Now,
dementia.
let's say, you know, you have periodontal disease, you're, you know, my age or above, and, you know, what are the types of things that, besides this good oral care, is there a way to actually reverse it, or is it something that you just are going to maintain and going to address throughout the course of your life?
Right. So great question. It's not something that we cure, it is something that we manage.
Okay.
You can't reverse it, we can only manage it. So, you know, that's something to see your dentist regularly, come up with a plan of how you can kind of control it, because you can control it.
Okay.
I use diabetes as an example. You can't cure diabetes, but you can control it so that your blood sugar is at the right level. So.
No, that's good to know, because that also encourages people to start early on. So some of our listeners that might be in our senior population, it's a good idea for them to encourage their children, their grandchildren, their great-grandchildren, you know, to be able to
Right.
take good care of yourself. We're always trying to not repeat history, and we want
Absolutely.
more and better for our own children, so it's good advice to start early on so that they can avoid maybe some of the mistakes that we have made regarding oral health and oral
Absolutely.
care. I love that you gave us some stories in the beginning. So I would love to have a story about somebody that had good oral health that comes in maybe in their 70s or 80s and you think, wow, how do you have a mouth like this? This is exceptional. So tell me about maybe a story.
And we see it. People might think it's a rarity, but you do see it. And I'm always amazed. I always ask them, how do they have that?
Yes.
They've always gone to the dentist regularly. They've always stayed on top of things. They've always been proactive. They've always told me that. They said, as soon as there's a problem, they take care of it. They don't let things sit. Small problems, small fixes. Big problems, big fixes.
Well, and I think, again, it's proactive and being able to make that dedication to going to the dentist. It's a cost, but in the end, the cost could be much greater in terms of not just your health, but also financially.
Exactly.
There could be, this gentleman that you so nicely laid out, and asked him, well, why do you want to do this? This is a lot of money to spend on a whole new mouth.
Right.
When you asked him that, I'm sure if you had said to him, well, if you could have done something differently not to be in this position, would you have? And I'm sure his answer would have been yes. And then if you were to compare the cost of what if he had taken care of his oral health all throughout his life, would probably be far less than what he had to have to do.
Yeah.
Okay. So I love that you see many cases of good oral health and people coming in and you being very pleasantly surprised, in terms of that. So let's go to the opposite. Let's go to some stories about when someone came in and what you then needed to do. We're talking a lot about periodontal disease, but maybe talk about things that have to do with cavities or other sort of oral issues.
Yeah, well, cavities, periodontal disease, you're going to have tooth loss if you don't treat it.
Okay.
So unfortunately, those are the cases that, you said to the other extreme, where someone is missing teeth. They say to you, I haven't been to the dentist for X amount of years,
right.
And
I'm
usually
sure
it's years.
People come in and they have their teeth and you need to help them make a decision about possibly removing teeth. I mean, nobody wants to do that.
Yes. Nothing I can build you will ever come close to replacing your natural teeth.
Right.
However, technology has improved, and that's also another testament to why we have seniors that have all of their teeth.
Okay.
Is because fluoride's improved, technology for crown and bridge, implants, that's all improved as well.
So give me some of the choices that someone might have if they came in and the tooth was too far gone and there wasn't going to be an opportunity for them to keep that tooth. What would be some of the options?
I have some models here,
All right.
so I'll bring them up so you can see them. So
hold them up nice and high so everybody can see them.
Yep. So if a patient comes in and they're missing a tooth, nowadays we have something called a dental implant. You may have heard, your grandmother or grandfather, may have had an old denture.
Okay, that's what that is.
This is what a denture looks like.
And they look really nice.
Yeah, they look nice, but one thing is they're removable. You can take it in and out. Imagine if I made you a piece of plastic and said, hey, you got to eat with this. And it would flop around.
And that at one point was really the only alternative.
That was the only alternative,
and
yes.
Having dentures, that is where you need to remove all of the teeth.
Correct.
So that is a big process. Right.
And then the other alternative, and that's when someone has no teeth. Sometimes the patient's missing a tooth, and so we'll make what we call a 3-unit bridge. And you can see all 3 teeth are linked together.
So it's not just the tooth that's affected, you're actually making it work together with the other teeth around it.
Exactly. So we're going to splint the 3 teeth. This is where the patient's missing their tooth, right here where we see.
Okay.
Now, in the last 15 years, something called a dental implant's been developed, and that's newer technology.
Look at this.
So you can see here that this is an implant. So the nice thing about an implant
That's a screw.
That's correct.
Okay.
So here, we don't have to touch any of these teeth to make that bridge. We can actually put an implant where the missing space is. We let everything heal in the bone. And then as we can see here, we'll then put an artificial tooth there. Okay. Now the patient will have individual teeth. They'll have their as close as possible to their natural teeth, and they can floss in between.
Okay.
The negative with this bridge, as you can see,
I was going to ask you, what's the pros and cons of each one?
Pros and cons is you can't get a cavity on an implant.
You cannot.
You cannot.
Okay.
It lasts close to forever as long as you take care of it. The only reason it would fail is 2 reasons. Biomechanical, meaning if you're grinding and clenching your teeth, you can loosen the screw. And then second is gum disease, if you get bone loss.
So you still have to take care of your gums.
You still have to take care of it. With a bridge, as we see here, if you get a cavity, let's say on this tooth here, you wind up having to replace the whole thing again.
The whole thing.
Every time.
So I would imagine case by case, you're looking at each individual person and seeing what the right solution is for that. Do you do all of these things at Emerson Dental?
We do. We have a specialist. We have a periodontist that places implants. And then myself and my associate, we actually do the restorative part of everything.
Okay.
So we're a multi-specialty practice where we can kind of keep everything under one
So
roof.
you're not needing to have referrals out to other
very rarely,
dental
unless it's a
professionals.
unless it's a rare case.
Okay.
Now this is I know I showed this as a denture.
I have to stop you and say that's very comforting, because a lot of times when people go to have something done, it's obviously not something they're happy about, they're worried about it. You know, to be able to stay in the same familiar setting is a real plus.
Oh, absolutely. It allows for the communication to be better too, because you know, the old style dentist used to refer you to an oral surgeon, refer you to an orthodontist, refer you to the endodontist. Now everything's under one roof.
Okay.
If there's any issues with communication, he pops me over and says, hey, come and take a look at this.
Yeah, and it's all about comfort, because like we said, not many people enjoy walking through the door. Although you do make an enjoyable experience.
Try to. So the other thing is, implants has now allowed us to also use it for dentures.
Really?
So those patients that you have that have dentures that are loose and they've come out, we now have the capability of putting anchors in the denture and allowing the implant to clip in.
So you're not having to use any of the
Fixodent or the denture adhesive.
The adhesive, that's the word.
And this will allow the dentures to feel more like natural teeth, because it'll be a little bit more stable.
Okay, great. This is amazing. All of these things that you've been able to show us. I'm floored by how much I've learned, certainly, and I know that our audience, I'm sure, has learned a lot. And you know what? I think the key is that after the show, if somebody is not doing these things, it's a clean slate, and it's never too late to start doing that.
Absolutely.
Okay. And I think that's important for our population to know too, is it's never too late to start taking care of your teeth and to pass it along to everybody else in your family.
It's never too late, and don't forget, it's never too early as well.
Ah, that's true too, on the opposite end. Yep. Excellent. Thank you, Dr. Wu. It's been a pleasure.
Yes, thank you for having me.
Emerson Dental right here in Westford, and obviously check them out. Thank you.
Thank you.